unit. And before we are able to use the TENS unit on somebody, you first want to find if they have any contraindications. Contraindications include history of cancer, cardiac conditions, high or low blood pressure, skin conditions, pregnancy, acute conditions, DVT or circulatory issues, sensory loss, lotions or oils, piercings or metal implants, as well as a pacemaker. Precautions include not using the TENS unit and the pads over a patient's broken area of skin, obesity due to electrical impedance issues, decreased sensation due to them not being able to feel, skin conditions, metal implants, decreased cognition or mental status, making sure they're cleared for active exercise, epilepsy, as well as spinal cord injuries. Proper electrode placements. You want to make sure the electrodes are not too close together, or this will not target the desired area that we are trying to decrease pain to. Electrodes placed too close can potentially cause a burn. Make sure electrodes are not spaced too far apart. Placing electrodes too spaced out can cause overflow to non-targeted areas of treatment. Where is the pain located is where you want to place your electrodes. So in this case, since we're doing it on the low back and for IFC, we want to surround the pain with both channels 1 and 2, making an X pattern. That way the treatment will be at the desired center of that X. Or if you're using the sweep, you can go ahead and pinpoint that area.
Acute parameters. So acute pain is more your sudden onset pain. So this will be 0 to 4 days. Your treatment time will be minutes to 24 hours. Pulse duration would be 60 to 100 microseconds. Your pulse frequency will be 80 to 150 pulses per second. And then with your intensity, you'll want to wait until you see the muscle twitch, and then you'll want to back down, but this can vary between each patient. So you'll want to make sure you're paying attention more to the muscle twitch than the numbers because they're irrelevant. For your chronic parameters, the chronic pain is like 15 or more days. Treatment time would be 20 to 30 minutes in the clinic. Pulse duration would be 200 or greater microseconds. Your pulse frequency would be 100 pulses per second. And the intensity, this one you would want to turn up until you see the muscle twitch, but again, you want to watch for the muscle twitch and not pay attention to the numbers because they can be irrelevant and you can miss the muscle twitch if you're not paying attention to that. Pulse frequency, so for smaller muscle groups, you'll want it to be 20 to 35 pulses per second. Larger muscles groups, you want it to be 35 to 50 pulses per second. And for any purposeful fatigue or muscle spasms, you'll want 80 pulses per second. And then what the patient should or should not feel. Acute settings, patients should feel more of like the buzzing sensation. So your treatment goal would be to mask the pain, so like an interruption to the pain. And then the chronic setting, the patient should feel more of a pounding sensation. So your treatment goal, you're basically trying to pound out your natural painkillers in your body to give a 4-hour pain relief. And then the patient should not feel any type of biting or pinching sensation when placing the electrodes on. If they do tend to feel that means it's not making good contact and the electrodes may be dried out, where you'll have to sprinkle some water on there so they're not so dried out, and you'll want to double check and make sure the electrodes are making good contact with the body.
And with IFC, this is going to help target the center of that X of the dispersive pads. And so what we're going to do is first select a time, then we're going to go to 20 to 30 minutes. So select, we'll say 20 minutes, then we'll go to select, pulse width or pulse duration is 200 to 400 seconds. So we'll start at 200 for patient comfort, and then this is 1 to 10 due to a chronic setting. So we're going to go ahead and we're going to put them at, say, 8. And then once we're at 8, basically we'll hit select again, and then this is going to go into the intensity, and so we'll go up until we see a muscle contraction and a twitch, and then we're going to see what the patient can tolerate, and then go to the patient's level of comfort and tolerability in order to maintain that muscle contraction. And then we're going to find the proper and comforting setting, and then we're going to hit select, and then we're going to go ahead and start the treatment for about 20 minutes. And then this will do the endogenous opiate effect, so it will provide about 4 hours of pain relief. And then you would want to do this for pain relief multiple times a day if it's really bothering you. So it's recommended about 4 to 6 hours afterwards, so you could do it a few times a day in between those sessions.
Alright, so first what you're going to do, you're going to plug in your wires over here. You're going to plug in your pads. Then you're going to use the 2x4 since it's low back pain because it's a larger area. And so what you can do, you can do an IFC setup, so where these two cross on the low back to target one area of pain, and then also you can also do a dual bipolar if you have like bilateral pain on your spine muscles. So like these will be on the same side, and then you'll turn up the channel, and you're going to wait until you see the muscle contraction. And once you see the muscle contraction, you'll back off, but I'll show you how to set that up. So first you're going to be in normal, then you're going to hit select to go to time, so I bring it to about 20 minutes. And then you're going to hit select again, you're going to change the pulse duration. Since this is acute, it's going to be 60 to 100, so I'd bring it to 60 for patient comfort. Start with that. And then pulses per second, since this is also acute, you're going to want to do 80 to 150. I would start at 80, so I'm going to bring this up to 80. Okay. And then that's how you set that. So you'll hit select again, and then it'll bring you to the channels. So what you're going to do, you'll just turn up the channels like this. And again, once you see the muscle contraction, you're going to pay attention to the muscle contraction. Just don't pay attention to the numbers because they are not relevant. So you'll just want to watch for the muscle contraction. And then once you see the muscle contraction, you'll want to turn it down until you feel that buzzing sensation. And so what this is to do, this is to mask the pain, so interrupt the pain during your treatment session. So what that's called the gate theory. So what that's going to do, it's going to provide pain relief during the treatment, but it's not like a 4-hour pain relief, it's just during the treatment time. And
we are going to get ready to go ahead and do a demonstration on a dual bipolar and a IFC quadrupolar setup.
Action.
okay, so we're going to go ahead and show you guys the dual bipolar setup. So this is how you'll have the patient set up and laying on their stomach. So with dual bipolar, one channel will be on one side, the other channel will be on the other side. So I'm going to turn up channel 1, and again, do not pay attention to the numbers, just watch for that muscle contraction. Justin, let me know when you feel this. Okay, I'm seeing the muscle contraction, so once you see that muscle contract, then you're going to back down. Justin, is that feeling okay? You still feeling something? Okay. Now I'm going to go ahead and turn up the other channel. Just watch for the muscle contraction. Justin, let me know when you start to feel this.
Alright.
You feeling it? Okay, now I am seeing the muscle contraction. So once you see that, since this is the acute, you're going to back down. And that's how you set up the still bipolar. Okay, so for IFC, we're going to say his pain's right there. What you'll want to do, you're going to want to plug one channel, so they're going to cross. So you're going to want one channel right here, other channel right here. Just make sure you follow the lead of your wires. Then the second channel, you're going to want to cross because you're trying to X marks the spot. And put the other channel right there. And then now you're going to turn up both channels until you see the contraction. And he should feel a buzzing sensation, so he'll let me know. Justin, let me know when you start feeling that buzzing. Feeling anything? Okay. Then you'll go ahead and do the same thing until you see that contraction. Feeling anything, Justin? Yep, okay. And you'll back down, and he'll feel that buzzing sensation, and that will mask the pain.